Hi friends, my name is Angela Hines, and today we are going to talk a little bit about telehealth and the OT profession. Some things we're going to go over is what exactly is telehealth? What is the role of occupational therapy practitioners in telehealth? What is the significance of mental health and telehealth? What are the OT core values, teaching principles, communication strategies, conflict management, therapeutic use of self, and interprofessional collaborations? We're going to touch a little bit on social and occupational justice, and we will wrap it up with the future of occupational therapy, telehealth, and COVID-19. So to begin, let's talk about what is telehealth. So telehealth is going to be any medical service that is provided on a technological platform and not in person. So that would be through a telephone call or any online platform like a virtual video conference. So what is the role of occupational therapy in telehealth? It's going to always be to provide client-centered care, to provide the patient with comfort and safety through that virtual platform. It's going to be to check in on the client's needs and progress of treatment. It's also going to be to provide outpatient services where they don't need to come into a facility or office. And it's going to be to assess mental health. And I feel like mental health has a great importance in telehealth because there are a lot of people who suffer from mental health dysfunctions that have anxiety and fears, and they don't want to go to a doctor's office and wait in the waiting room or be in that close contact due to their dysfunctions and the things that they need help with. So mental health is a great area that can benefit from telehealth services. All right, let's touch a little bit on the OT core values. So the OT core values are going to be, number one, altruism, which is the unselfish concern for the welfare of others. Number two, equality, which is the same rights for all. Number three, freedom, exercising choice and independence. Number four, justice, upholding of fairness, equity, and truthfulness. Number five, dignity, which is the importance of value of worth for each individual person. Number six is truth, which is being faithful to facts and reality. And number six is prudence, which is the governing of oneself through reason. These are the OT core values. Let's talk a little bit about the teaching principles. I always want to consider human dignity, the rights of workers, call to family, community, and participation, solidarity, rights and responsibilities, the priority for the poor and vulnerable, and the stewardship of the planet and taking care of it, and always the promotion of peace. So communication is really important for any relationship, and it's also true for the OT and client relationship. So here are some strategies for being an effective communicator. Number one is always be clear and succinct. The saying here is less is more. Number two, always have integrity in your communications, which is basically being honest and consistent. Number three, listen more than you speak. Be an active listener. Be fully engaged and respond with statements like, I hear what you're saying and tell me more. Have a sense of trust going on between you and your client in your communication. That goes back to integrity and consistency. Number 5 is consistency. Be consistent. Don't say one thing one day and then something else the next. That's going to break into the trust and integrity that you're trying to build. Be an active listener. Number 7. Be able to rephrase what you're hearing and invite further conversation through that active listening. And lastly, provide productive feedback. That's really important because you need to provide positive and constructive feedback in your communications. We all know conflict is able to arise, and it's important to know how to manage conflict, even in a telehealth platform. So it's important to understand the source of conflict. It could be assumptions or unmet expectations, or perhaps the person feels disrespected or like they're being blamed for something. And it's good to know the possible approaches when you encounter the conflict. Being assertive is going to be the most productive approach. The positive outcomes of conflict. There are positive outcomes of conflict, such as personal growth and improved clinical outcomes. Therapeutic use of self is something that we will always need to be actively doing, whether we're in person or on the telehealth platform. And so the first thing to know about therapeutic use of self is that awareness is key. You also have to accept responsibility for your own actions and your own words. You need to acknowledge and understand each client's interpersonal characteristics and maybe adapt your style to better jive with your client's interpersonal characteristics. Always remember to advocate, collaborate, empathize, encourage, instruct, and problem solve with your client. It's important to begin with the desire to work with the client and the awareness and consideration of the relationship factors. Using therapeutic use of self is the best way to have that purposeful, client-centered communication and treatment going on. So interprofessional collaborations are so important for occupational therapy because we take a holistic approach to our treatment plans. And how can we do that on our own? We need to be able to collaborate with other professions. And so interprofessional collaborations is actually multiple health workers from different professional backgrounds working together with a client and their families and their community to deliver that high quality care. And they do that by setting a culture of cooperation, coordination, and collaboration. They train together, they develop programs together, share electronic health records, demonstrate leadership and professional behaviors, and always the focus is that high quality, client-centered care. So social and occupational justice for the occupational therapist, to us it means that we will treat all clients fairly and equally regardless of race, class, culture, or sex. We will relate to others respectfully and unbiased, and we will promote an environment of equal opportunity for all persons to have the freedom and ability to participate in occupations. So what does the future of OT, telehealth, and COVID-19 look like? There are many pros, which is improved access for all, including those that are at higher risk for falling susceptible to COVID-19 and other illnesses. They can stay safe in their own home and still receive care. Telehealth is less strenuous on the OT's body, and it provides on-demand care. You can literally have a telehealth appointment in your car, on your lunch break at work, wherever you are. It's very convenient. The cons are that we're going to miss that physical interaction and touch, and I think that's an important thing for any relationship. Right now there's also reimbursement issues, just due to all the changing regulations, but hopefully those will all get worked out. Thank you for listening to my presentation. I hope you learned something, and be blessed.